Hello everybody. It is Sunday afternoon, January 31st, 2021 at 1 o'clock p.m. and I'm Dr. Naomi here to talk to you guys about coronavirus, COVID-19, the COVID-19 pandemic, your immune system, the vaccine. So invite everybody on, tell them that Dr. Naomi is on and we're going to talk everything coronavirus. And so sit back. I want to let you guys know that I'm going to try to break this down. I'm going to try to make this easy for the layperson to understand. There's a lot of vaccine hesitancy, some distrust, some mistrust in the Black and brown communities, and I am here to help you guys decipher this stuff. I have my husband here who's going to be helping me through. I'm going to toggle on over here onto my computer because I need to be able to share this on my professional website, and this is a new thing for me, but we're going to do this. Kelvin, can you get my rings from the kitchen, please, next to the refrigerator? Okay, so right now I'm going to hit share. So I'm going to share this to the public. And like I said, bear with me because I don't know how I'm going to be able to share this on my professional website. But we're going to figure this out. May not be able to, but I thank you all for joining me. We are going to have a grand old time on this Sunday afternoon, and I just wanted you guys to know that I'm on the East Coast in New Jersey, and we are headed for our first winter storm of the season, so we are expecting some accumulation of rain and snow and things of that nature. So I hope everybody up and down the East Coast is preparing and that you are staying safe. So I have got to ask you to bear with me with my papers. I have been reading so much about this coronavirus. I have so much information that I would like to share with you. I'm going to hopefully dispel a whole lot of myths. Hopefully, so what I'm not going to do is be on a political platform. So what I have to say has absolutely nothing to do with politics. I'm coming before you as a board certified physician, giving you information, giving you facts. I'm going to talk about the science. I'm going to talk to you about your immune system, about this vaccine, how it's made, how this particular vaccine works, how it works with your immune system. I'm going to give you some information that you will hopefully use to have informed consent. Whenever I give a vaccine to a patient, the parent always has to sign a form for informed consent. And what does informed consent mean? It means that you have been given an opportunity to have information presented to you that you are going to use to make a knowledgeable decision about whether or not you want to receive a vaccine or for your child to receive a vaccine. So that is what informed consent is. And hopefully today, I'm going to give you all some information that will allow you to have some information so that you can consent to receiving this vaccine for yourself. Okay. So the first thing that I want to talk about, let me kind of give you an outline so that you know where I'm going, because I know that you guys have some questions. I did look at the questions that were posted on a video that I put up last week where I asked you to write down some questions in the comment section. I did look at all of them, and a lot of them I'm going to address in what I'm saying. So I'm going to give you a timeline, or actually, a subject line for what it is that I'm going to talk about, and hopefully your question is going to be answered, but certainly at the end, I am also going to have some time where I'm going to actually take the time and look and read over your comments. My husband is here to help me to decipher the comments, because I know that I'm not going to be able to to look at them the entire time, and also that would be kind of rude. So I'm not going to do that. My attention should be on the screen and not on my computer. So as a matter of a way for you to know where I'm going to talk about your immune system. I'm going to talk about this virus. I'm going to talk about how you can test for this virus, what the results mean if you have a positive test, what it means if you have a negative test. I'm going to talk about how the virus is spread, how to protect yourself. There were some questions about how to care for someone in your home who may be infected with the virus. We're going to talk about that. I'm going to talk about treatment, the vaccine, big information. I got a lot to talk about the vaccine. And also, at the very end, we're going to go over some kind of myths and some facts. And hopefully, if you are good students, can you turn your volume down? I'm sorry. Hopefully, if you are a good student of what I have taught, you'll be able to answer some of these questions that I have for you at the end for yourself. You'll be able to know whether it is fact or fiction. So, okay, so let's begin with your immune system. So everybody has an immune system, and your immune system is defense against infection. Everybody has this immune system. So what happens when we get infected with germs? We're not talking about the coronavirus right now, just germs in general. So they come into your body and they attach to cells, and then they begin to multiply. And once they multiply, this is what is called an infection. So when these germs come into your body, they have proteins specifically that they inject into your cell that replicate and multiply and cause infection in your body. So we have defense systems in our bodies to help us fight infection. So there's two different cell lines in your body. You have your red blood cells and you have your white blood cells. So what do the red blood cells do? Well, the red blood cells carry oxygen to the cells in your body, and we know that your body needs oxygen. All the cells in your body, all the organs in your body, the tissues in your body needs oxygen to work properly. So that's the red blood cells. Well, your immune system, when it fights infections, has to do with the white blood cells. So we're going to talk about this is a little lesson on immunology for you. So we're going to talk about white blood cells in the terms of three specific types. You have your B cells, you have your macrophages, and you have your T cells. So macrophages are a certain type of B cell. So what do macrophages do in your body? If anybody remembers the video game Pac-Man, the Pac-Man comes and you're trying to eat up all those little dots. Okay, so think of macrophages as the Pac-Man or the Miss Pac-Man, whatever. I mean, we just going to be Pac-Man. So the macrophages in your body, when these germs come into your body, they're going around eating them up. Eat. They're like little garbage tanks. Okay, so the macrophages come in like little Pac-Men and they eat up these germs in your body. So when they're eating them up, they're pretty sloppy eaters. They don't, eat properly. They don't have a napkin. They don't care. They just eat. So when they eat, parts of the germ that they eat are broken down. So they don't dissolve everything. There's small parts that are left behind that are these dead cells and fragments that are left behind. And they produce in your body what are called antigens. Antigens are not nice in your body. We don't like antigens. So when these antigens are there are different cells, different B cells that attack your antigens. So they're like these B cells are at a fort, and they're looking for all the leftover fragments that these macrophages are producing, and they attack those. And how do those B cells attack those antigens? They produce antibodies. We like antibodies. So antibodies are defense mechanisms produced by white cells in our bodies to fight infection. So you have this fortress of B cells that are bam, attacking all of those antigens that are left behind, that are foreign, that should not be there. And then we have these T cells. So T cells come into your body, and you know, the B cells are like, yeah, I got your back. I'm going to get these antigens out of the way. Well, T cells help you to help you to develop memory, so that you remember what was there before, because the B cells that got your back, well, they can't get all the antigens. So some of them are left behind. So the T cells come in, they're like, you know what? I'm a sniper, because what I'm going to do is those B cells that are now infected with the antigens that the boys who couldn't get your back got, well, now the T cells are going to come in. They have some killer T cells that are like snipers. And they're going to come in and they're going to attack those B cells that have the antigen in them that are replicating and multiplying. Okay, you got it? So we have macrophages that are eating up all the antigen, eating up all the germ cells, leaving some antigen behind. We got the B cells that got your back, that are doing their best to get your back, but sometimes they don't have it all. But then the T cells come in and like, I'm going to snipe these out, and I really got your back. I'm going to take care of it. So that's your immune system, and that's how your immune system works. So building immunity takes time. So when your when your body gets infected by a germ that causes an infection, it takes 1 to 3 weeks for your body to build immunity. 1 to 3 weeks. So this isn't anything that happens overnight. So it's going to take time. Whenever you get infected with something, it's going to take time for your body to build immunity to have a response to what it was infected with. So this is going to be important later on when we talk about vaccines. Okay, so talked about T cells being memory cells, these B cells helping you out. Okay, so now, so let's talk about this virus. So coronaviruses in and of themselves are not new. They are a large family of viruses, and they actually happen to cause the common cold. So it's really important for us not just to say, oh, coronavirus. It's actually a specific type of coronavirus that's circulating right now that's causing infection. So there are actually alpha groups, beta groups, gamma groups, and delta groups. Okay, so the alpha and the beta groups of these coronaviruses are what cause infection in humans. And the Sars Cov-2 is the virus that causes COVID-19. So Sars Cov-2 is a severe acute respiratory syndrome virus. So the SARS-1, I don't know if you guys remember, there was an outbreak that was called SARS. That was this coronavirus that was that caused the pandemic, not in America, but in other countries. And then there was another one which was called MERS, which is the Middle Eastern Respiratory Syndrome. So now this virus that we have here is the SARS-CoV-2 virus that causes COVID-19. So how do we come up with the name COVID-19? Well, there's this thing that's called the World Health Organization. Very important organization. So the World Health Organization actually has a study group that's the International Committee on Taxonomy of Viruses. So viruses get names. So SARS-CoV-2, nobody's going to be running around saying SARS-CoV-2 or remembering what SARS-CoV-2 is, but you will remember COVID, COVID. CO is for corona, VI is for virus, D is for disease, and 19 is because it was first recognized in humans in this country in December 2019. So COVID-19 is the disease that is caused by the SARS-CoV virus. And so this coronavirus is a novel coronavirus or a new coronavirus. The virus is not new to scientists. The virus is new to infecting humans, okay? So the novel coronavirus, Sars Cov-2, causes COVID-19, which is a pandemic across this earth. Okay, so what does this virus cause? All right, every person who is infected with this virus does not have every symptom that this virus has the potential to produce. In fact, you can be an asymptomatic carrier of this virus, which we will talk a lot about later. So right now, I'm not talking about the asymptomatic carriers. I'm talking about those who have symptoms. And so there are a myriad of symptoms. You can have fever. It could be low. Okay, so a fever is 100.4 degrees or higher. So if you got a 99 or 100, you do not have a fever. Please do not take a fever-reducing substance when you do not have a fever. Our bodies are very smart, and our immune systems prefer to work in an environment that's warmer than the normal body temperature. Normal body temperature is like 97.6 to 98.6. So in that range. So when your body starts creeping up higher, when there is an invasion by a foreign particle, a germ, then your body gets warmer, and your body's immune system knows what it's doing, and it performs better when your body is warmer. So as a matter of, I guess you can say, a guide, it's good if you don't treat a fever until your body's temperature is 101 degrees Fahrenheit or higher. So a fever, by medical definition, is a body temperature of 100.4, not 104, 100.4 degrees Fahrenheit. So anywhere between 100.4 and 100.9, just allow your body to be warm. It likes to be warm for the immune system to work. That was a sidebar. But at any rate, you can have fever, you can have runny nose, sneezing, cough, difficulty breathing. You can have body aches. You can have headache. You can have a sore throat. You can have chills. You can also have vomiting, diarrhea, a rash, a new loss of the sense of taste or smell. So those are just some of the things that you can have. If you have all of these things, you don't need to say, oh my gosh, I have COVID-19, I have this disease, I need to go get checked. Because just because you have those, especially now that we are in the middle of the cold and flu season, just because you have these symptoms, I don't want you to be so anxious that you have so much anxiety that you are overburdening yourself with this virus. Stress is not helpful for your immune system. Decrease the amount of stress you have, get some sleep, exercise, eat right. These are some things that you can do on a normal day to help keep your immune system working properly, so that when your body does experience something that's foreign, it'll be prepared to go into hyper mode and do what it is supposed to do. So some things that it seems like are specific to the pediatric population is this multi-system inflammatory syndrome in childhood. It's called MIS-C, M-I-S-C, multi-system inflammatory syndrome in children, where children get this children and adolescents get this specific kind of rash and inflammation all through their bodies. And then there's also something that seems to be specific in the pediatric population. Is called pseudo chilblains. And chilblains is a type of illness, if you will, or symptom that children get, where their feet and their fingertips almost look like they're frostbitten. They're really red and kind of have a violaceous or a purple kind of hue to them, and red and kind of swollen and looking like they're peeling. So that's called pseudochilblains, and it's one of those things that's kind of unique to the pediatric population when they are infected with this virus. So if you are sick enough with this virus, then of course you would go to the hospital and be assessed to see if you need to be admitted. So while I'm talking about this, I was going to do this a little bit later. You know, I might as well just kind of go into this right now. So we were, well, no, I'm not going to do that out of order. So those are some things about COVID. So now I want to talk to you about tests, and more tests for COVID. So when you go to your local primary care physician's office, if you go to an urgent care center, if you go to one of these drive-through or drive-by testing setups that are in your community, you will most definitely be receiving a viral antigen test, not an antibody test. Remember, antibodies take 1 to 3 weeks for your body to produce. So you are going to receive an antigen test. Antigens are viral tests that look for current infection. Most of the tests, the majority of the tests, are going to do a nasal swab. Some of them may do a nasopharyngeal swab. So a nasal swab goes into your anterior nares, right in the front of your nose. The nasopharyngeal swab is going to go into the front of your nose a little bit farther back down to your pharynx, which is considered your throat, but it's going to be the top of it. It's a very uncomfortable test, as the swab that is used has fine bristles on it. And when the test is being done, the swab has to go back and actually be turned to like 180, 270 to 360 degree rotation in order for those bristles to get the virus from the cells, to get some cells. So it's a very uncomfortable test if you do the nasopharyngeal test. The nasal test is not as uncomfortable, but it is still uncomfortable because, like I said, the swab that is used has bristles on it. There are a few tests, limited, that actually do saliva. So you may go to an urgent care center or a testing center and they will swab the inside of your cheek. I have not done any investigation per se into what is better, whether you do the saliva test or the respiratory test with the nasal swab. I don't have those specifics for you, but just know that if you get a test, it's an antigen test that is going to look for current infection. The rapid antigen test, normally 10 to 20 minutes, you will know. The gold standard, however, is called a polymerase chain reaction, or a PCR test. Depending on if you go to a hospital or a laboratory, you may be able to get that back rather rapidly at those types of testing sites. But the one that we particularly do in our office, we send out to like a LabCorp or a Quest, and the results are back in sometimes 24 hours, but most definitely in 48 hours. So those are tests that you can use to see if you have a current infection. There are, and they are very sensitive tests. If you do a rapid test, however, you should still have that followed up with a PCR test. And normally when you get the test at these sites, if they're going to do a rapid test, they swab you at the same time and use one swab for the rapid test and the other swab for the send out test, so that you don't have to be swabbed twice. So if your rapid test is positive, it means that at the time the test was taken, you were infected with the Sars Cov-2 virus. And when you do your PCR, it will most likely also confirm and also be positive. If your rapid test is negative, it means the time the test was taken, you were not infected with the Sars Cov-2 virus, or you were infected, but the test was done too soon. So usually we will say, if you have symptoms, we prefer that you do not get tested unless you have had symptoms between 5 and 12 days. I know this is difficult. A lot of people who are concerned about whether they are infected with the Sars Cov-2 virus, you want to know, and you want to know soon. Am I going to be able to go back to work? What am I going to do with my children? Can I go here? Can I go there? But you really, really have to be patient. We like for you to wait 5 to 12 days. Usually 5 to 8 days is a good time from the time you started symptoms, from the time that you get your test, because the idea is for you to get a test that reflects the true status of your immune system. You don't want to be positive and run and get a test on day 2 or 3 of symptoms and say, it's negative, I'm good, I can go about my business. And then 5 days later, well, now you have more symptoms. Now you have lost your sense of taste or smell, and you go and get tested again and you're positive. But between that day 2 when you were tested and say day 8 or 9 when you get tested again, you thought you were negative, and during that time frame you have potentially infected other people. So just kind of be patient with your symptoms. The majority of the people who are infected with this virus will recover at home. So even if you do have it, even if you don't go get tested to confirm your infection, you will most likely recover at home. But these kinds of tests are important for people who are in colleges or universities, nursing homes, correctional facilities, detention facilities, where serial testing of asymptomatic persons might facilitate early case identification. So in those kind of settings, if a lot of you people work in those kinds of settings, then you know you may get tested every week. Depending on where you work, you may get tested 3 times a week. So that's what that is specific for. So they are very reliable if you are symptomatic, but the sensitivity when you don't have symptoms is kind of low. So that's about the viral test. Now the antibody test is a blood test. You will not be able to do a drive-through setting and do an antibody test. So why do the antibody test? The antibody looks for past infection. So there are some people who will say, I believe this was one of the comments that somebody made on my post, is that, okay, so I think that back in March of 2020, before we really knew what was going on with this pandemic, the virus wasn't really known. People weren't really talking about it. Or even back in February, you know what? I or a family member had this really bad cough that we just couldn't shake. We were, oh my gosh, we were so fatigued. We couldn't move. We had the worst headache of our lives. We went to our primary care physician. We thought we had the flu. We just knew that we had the flu. We had a flu test done and it was negative, but it took a good, 2 to 3 weeks for recovery to happen. Did I have COVID? And a lot of people say, should I be tested, and what does it mean? So this is where the antibody test comes in. So, and this is where scientists are still working to see how protective your immunity is after having been infected with this virus. So, like I said, it takes 1 to 3 weeks for the antibodies to be produced in your body. We just don't know how long that immunity lasts. So, if you had or someone you know had this scenario of an infection that I just said, you could go and have your blood tested for the antibodies for the Sars Cov-2 virus. If you do not have the antibodies now, which it is, tomorrow is going to be February 1st, and you think you had this infection 12 months ago, if you have antibodies, what the test will tell you is, yes, you do have the antibodies, and yes, you did have a past infection. But what it cannot tell you is when you had that infection. So hindsight is 2020. Had you had those symptoms back in February, March of 2020 and had your antibodies drawn in April, May, then you could probably say with a great percentage of a surety that yes, you did have that infection at that time. But doing the test now, if you got it done tomorrow in February and it was positive, you would not be able to say when you were infected at all. We would just be able to say, yes, you had a past infection. And that is true also of people who are asymptomatic. You can go tomorrow and have a test, get the results back in a couple days and say, whoa, 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 whoa. How am I positive for SARS CoV-2 when I never, ever had any symptoms? That is what we call an asymptomatic carrier. So you, with your cute self, could have been walking around saying, I had no symptoms whatsoever, and here you are, asymptomatic, and could have been spreading the virus. So yes, you can get an antibody test. Yes, it will tell you if you had a past infection. No, it will not tell you when this infection took place. So this is a laboratory test that requires a blood sample. This is not the kind of test that you can get at a drive-up setting. Okay, so I talked about the test and the positivity of the test. So a positive result shows that you may have the antibodies from this infection. Other coronaviruses cannot produce a positive result on a viral test for SARS-CoV-2. So remember I told you that the coronaviruses are a class or a family of viruses and that they actually do cause the common cold? When you get a test for SARS-CoV-2, it is specific for the virus that causes COVID-19. A SARS-CoV-2 test will not show positivity if you have one of the strains of the coronavirus that causes the common cold. So please, 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 there is no misconception there. The lab test will not be confused. Okay, so that's that. Now, if you have a negative result, like I said, you may not ever have had the infection, or you could have a current infection that you were tested too early for. And some people, there are some people who actually never develop antibodies. And since we don't know how long these antibodies last, this is another reason why if you did have COVID-19, that you should not be so sure of your protection and say, I don't need a vaccine because I already was infected with this virus. I'm not going to get the virus again. That is absolutely something that the scientists are working on to see for how long does natural immunity last. It's very, very important not to get that confused. So, so this virus is spread from person to person through droplets and aerosols. So that means if you're within 6 feet, which is why they say physical distancing of 6 feet, because if I'm just sitting here talking, there are a lot of droplets coming from my mouth. There are aerosols. If I, excuse me, cough like this and I don't cover my mouth, or I cough like this and, or let me go. Can you see that? I coughed into my hand, but my hand wasn't right over my mouth. So that's an aerosol, and it can actually spread the virus. So that's how it's spread from person to person through droplets and aerosols and in close contact. So how do you protect yourself? Oh, I'm sorry. Let me pause for a moment. Kelvin, do I have any questions that I need to address right now?
Not yet.
Not yet. Okay, guys, thank you. Okay, so how do you protect yourself? Okay, so number one, avoid going to places where there's an outbreak. Okay, avoid contact with people that you know are infected. You know, I know some of these things are what we would say are common sense, but sometimes we need to say what should be commonly known. We should still speak of it, because sometimes you don't think about those things. Avoid crowds, and if you are, you know, physically distance yourself from someone for 6 feet or 2 meters. Okay, and wash your hands frequently. Wash your hands frequently with soap and water, preferably. So 20 seconds. So everybody knows washing your hands for 20 seconds. What are we singing? We're singing a happy birthday song. And how many times are we singing it? We're singing it twice. So you're washing your hands, the front of your hands, meaning this part, the palms of your hands. You're washing in between your fingers. You're washing and you're washing with warm soapy water for 20 seconds, and then you're drying thoroughly. If you are not near soap and water, the second best thing is, of course, an alcohol-based hand sanitizer. 70% or more alcohol will do you good. You know, some of these things for the ladies, you'll go and you'll get these really smell good hand sanitizers, because you want to, okay, yes, you're using alcohol, but you want your hands to smell good as well. Just please make sure the alcohol content is at least 70%, because some of these things like 20-30%, they're cute, your hands smell good, they're clean, but they're not killing any germs. So the idea of a hand sanitizer is to sanitize your hands from germs. Okay, so the alcohol is what is doing the sanitizing and not the fragrance. Okay, all right, so you're going to protect yourself from others. So we talked about getting rest, we talked about exercising, we talked about eliminating a lot of stress in your life, because stress is just not good for your immune system. So stay home if you have to unless you have to go out. So if you are sick, we know that if you are sick, you do have to go out to a physician or some other kind of healthcare provider so that you can get tested. If you're sick and you go out, of course, we want you to wear a mask. And what kind of mask can you wear? So a surgical mask, of course, I don't have one in front of me, but everybody knows what a surgical mask is, the kind of mask that the physicians use when they go into surgery, the kind of mask that you see the healthcare providers wear in these healthcare settings. Those are surgical masks. And then you can also have a fabric mask that is made out of material. So if you have a fabric mask, it should be 2 layers of fabric. So I know, and the mask should cover your mouth and your nose. Kelvin, are you finding me a mask?
Yes, you are.
Okay, so here is a surgical mask. Okay, so you put the surgical mask on, and it's supposed to cover your nose, and it's supposed to cover your mouth, and there's a good seal right here. Okay, so this is a properly fit mask, a properly fit. Okay, so that is a properly fit mask, and there are several layers in there. Okay, so when you put it on, you want to have this wire part at the top of your nose so it can press down. Yes, I know some people say that they have difficulty breathing with these masks on. but this is a sufficient mask for you to use. Also, I'm not going to show the logo on here. This is my son's mask. I'm going to turn this around because I'm not advertising anybody. So I'm going to turn the logo around. But this is a fabric mask, and it actually does have 2 layers. And how do you know if you have 2 layers? I don't know if you can see this, but I'm pulling this apart. You see I'm pulling on this side, and I'm also pulling on this side. See do you see that? That's what you call a 2-layer fabric mask. If you have a fabric mask and you pulled on it, and let me just put these 2 layers together. If you pulled on it and you're only pulling on one side, that's not 2 layers, okay? A 2-layer fabric mask is what you should be using if you're using a fabric mask. And again, when you put it on, it's going to cover your nose and your mouth, and it should have a good seal around here, okay? So it'll cover your nose and your mouth and produce a good seal on the side and a good seal here. This right here ain't it. That ain't it, y'all. I know you get tired, and I know that you want to breathe, but wearing your mask like this, it's not protecting you, nor is it protecting the person who's next to you. So please don't do that. Another kind of mask, I'm sorry, I just wanted to, I apologize. My computer went quiet on me, and I just want to, okay, I'm sorry. So you want to protect yourself with that mask. The other kind of mask that you can wear is an N95 mask. I'm not going to put that on only because it's a little, no, you can get it so I can see it. It's a little cumbersome, and I'm just not going to put it on right now. But when you put an N95 mask on, or even a K95 mask, those masks make complete airtight. Those masks make complete airtight seals, and you can wear them for a long time, all day. In fact, healthcare providers that work in your urgent care centers and in hospitals will do this right here is actually the N95 mask. So it actually has this kind of string. This particular N95 mask goes around your ears, but it produces a significantly tight seal. There are some N95 masks that you will see. A lot of people who work in construction were already wearing these types of masks. So they actually go over your nose and your mouth, and then they have a strap that goes over your head that should be down here, and another strap that goes over your head that should be up here. So when you see people who have a mask on and the straps go all the way here, they go over your head. Sometimes you will see people who are well-intentioned but wearing an N95 mask incorrectly. So if you see somebody who has a mask that has the loops where there's a loop here and a loop there, but the loop that goes under the bottom is like hanging down here because they didn't put it over their head. So they have I'm sorry that I don't have one with me right now, but they have the top string going here, but they didn't bother to put the bottom string over their head to make a nice seal. So their mask has a loop that's kind of hanging like this. That's not good, because if your intention is to wear a mask that's going to give you a better seal, and you don't put both of the straps over your head properly, then you've negated the fact of having an N95 mask, and you would actually be better served by wearing the regular fabric mask. Okay, so that's that about masks. So that's how you protect yourself. Like I said, cover your nose and your mouth at all times, and wear a double layered cloth mask. Of course, also if you are sick. Okay, so let's talk about, somebody had asked me the specific question about how do you take care of someone in your home who may be infected and has to self-quarantine. So that's really important. I'm sorry, just a moment. I think I have a question. Okay, on warfarin for 40 years, will the vaccine affect this? I'm going to do a vaccine question later. But I do thank you for your question. But I will. That's a vaccine question which I will address later on in the talk. Oh, okay. So back to caring for a person who is sick in your home, if at all possible, because just because one person in the home has been infected with COVID, it doesn't mean, okay, it's a free-for-all. There are 5 people in my home. This one person is infected. Now all 5 people are going to be infected. That is not at all what's going to happen. So the person in the home still should be able to be self-quarantined. If you can, they need to stay in one room. And if you have more than one bathroom in the house, allow them to use a separate bathroom. You should disinfect your home every single day. You can use disinfectant cleansers, wipes, or sprays. Make sure, again, common things commonly: doorknob handles, stair rails when you're going up and down the steps, microwave handles, the refrigerator door handle, remote controls, your cell phone, computer keyboards, countertops, tabletops. All of these things should be disinfected every single day if you have someone in your home who has COVID. Now you can prepare meals for this person, put them on a tray, use takeout, disposable cups and plasticware and plates and napkins for the person in your home who is infected. Use a tray of some sort to take the food and sit it outside of their door. And they should have a trash can inside the room that they are quarantined in that has a plastic bag, so that when they are finished eating, they can dispose of their products in that trash can, and then that bag can be tied up. The person, if you have to do their laundry, handle them with gloves. Separate the laundry with gloves. You will probably not feel comfortable washing their laundry with other laundry in the home, but it's actually okay. You can wash the clothing in the hottest temperature that the label recommends. So if it recommends warm, please don't wash your clothes in hot water trying to destroy a virus and you end up destroying your clothing. Kelvin, can you turn that on, please? So please don't destroy your clothing by washing it in a temperature that's too high. So you can do that. Dry them thoroughly. Don't leave them damp. Don't hang them to dry. If they have clothes that should not be placed in the dryer, then you definitely don't want to wash somebody else's clothes with them, because they need to be washed in the warmest water that the fabric label allows and dried thoroughly, still using gloves to handle them. And like I said, there have been, now I can't give you the source for this, but there have been studies that have found this virus in the sewer water. So the virus has been found in sewer water, which means the virus is excreted in urine and stool. So when you use the bathroom and you flush the toilet, it goes into your septic system. And so that's one of the ways we found out that if you have gastrointestinal symptoms of vomiting and diarrhea, that can actually be a sign that you are infected with this virus. Early on, we thought it was if you had a cough or if you had difficulty breathing, loss of taste or smell, but now we know that you can have gastrointestinal symptoms and that be a source that, indication that you are infected with this virus. So this is the reason why we say have the infected person in your home use a separate bathroom. If you only have one bathroom in your home, then of course everyone in the household must share the same bathroom, but once the infected person goes in to use the bathroom, the toilet seat, excuse me, the toilet seat, the knobs, countertops, everything, shower handles, everything in a bathroom should be disinfected after the infected person has gone in to use it. Okay. So that is that. When can you end self-isolation? This is a big question. So if you are infected, or if someone in your home is infected, they have to be fever-free. Remember, what do we say a fever is? 100.4 degrees Fahrenheit or higher. So they have to be fever-free for 24 hours without the assistance of medication. So no acetaminophen, no ibuprofen, which means no Tylenol, no Motrin, no Advil. If you're an older person and you're on aspirin already, that means no aspirin. You have to be fever-free for 24 hours without the assistance of medication, and your symptoms have to be improving, and it has to be at least 10 days from the onset of your symptoms. If all three of those parameters are not met, neither you nor the person in your home can come out of self-isolation, okay? I know that we want to get back to doing what we're doing, and some people are getting COVID-19 pandemic fatigue. Please don't get fatigued. If you get sick, please, please, please be responsible. No fever for 24 hours without the assistance of medication. Your symptoms are improving, and it has been at least 10 days from the start of your symptoms. Okay? So please, people, please keep that in mind. And like I said, caring for someone else. I think I went over all of those, but I just didn't want to forget anything. Oh, like I said, the dishes, the cups, towels, and bedding. So make sure the infected person is using their own towels. And of course, if they're sleeping in a room by themselves, then they have their own bedding. But if it's your spouse, you know, I don't know what you can safely do about that. I guess the uninfected spouse would have to be out of the room. I guess this is a case when, you know, it's cool to sleep on a sofa, because if your spouse is infected with coronavirus and you don't have a room for that spouse to go to, then you're going to have to sacrifice, and you, the uninfected spouse, is going to have to sleep on a sofa so that person can be isolated in the bedroom. Okay, so we talked about laundry and high touch areas. Okay, so now we're going to move into treatment. So like I said, the majority of people who are infected, I am so sorry. Okay, the majority of people who are infected with coronavirus are going to do just fine, and you're going to be able to recover at home with what healthcare providers call supportive care. Supportive care are those things that you use to help you feel comfortable while you're fighting the virus, to reduce your symptoms. So if you have a fever, you take a fever reducer. If you have a headache, or you have all of these myalgias, which we call body aches, you're going to take something that's going to help reduce that, which could be ibuprofen or acetaminophen. If your throat is scratchy or sore, you want to make sure you hydrate. Hydration is very important, because when you have a fever, you lose water from your body as it evaporates when you have a fever. So it's important to stay hydrated. You can use water. You can use tea, hot tea with honey. You can use fruit juices. A lot of people want to hydrate with these electrolyte solutions or sports drinks that you can purchase from the store. I want to caution you against that because those things are actually called rehydration solutions. And you don't want to use those unless you are dehydrated. So if you have a fever and your throat is scratchy and dry, you're not necessarily dehydrated, and you're actually will be using hydration just as a maintenance. However, if you have a significant amount of vomiting or diarrhea because of this infection and you need to be rehydrated because you're losing potassium or sodium chloride, then it's okay to use those rehydration solutions over the counter. I'm not going to name them, but those electrolyte rehydration solutions that you can use over the counter. Be careful with the sports drinks because although they say, oh, you know, you're working out, you're sweating when you're doing sports, those drinks have a lot of sugar in them, and you want to be careful about the sugar. So that's for mild symptoms when you're at home recovering. But let's say your symptoms progress and they become more significant, well, then you're going to have to go to the hospital. If you go to the hospital, sometimes you can be just triaged and taken care of in the emergency room. You may need an IV fluid bolus of saltwater saline to get rehydrated. If you're a little bit dry, we call it. You can get that, you know, be given some medication for aches and pains and things of that nature, and then they will likely send you home even if you are positive. So please don't be disheartened if a healthcare provider sends you home. Most of the time, if they send you home, it means that your disease is not severe, and you can thank God for that and go home and recover at home. Even if you've lost your sense of taste and smell, it's best for you to go home and recover. For those who are less fortunate and require hospitalization, then one of the mainstays of treatment is oxygenation, because a lot of times you have COVID pneumonia because this virus loves to attack the lungs. So if you have COVID pneumonia, you're going to receive some oxygen to help with your breathing. They may give you an antiviral. The one that is most commonly given is remdesivir. Antibiotics do not treat viral infections ever. Sars Cov-2 is not a unique virus that an antibiotic will not treat. No virus is treated with an antibiotic. It's just not what you do. You use an antiviral. So remdesivir is the one that you use. This virus causes inflammation in the heart. So you get what we call a carditis or a myocarditis, where you have inflammation of your heart muscles. So that will be addressed. It also tends to form a thrombus or a blood clot. So a lot of times you will be placed on a blood thinner. Lovenox is a common one to prevent these blood clots, because if you have a clot that's formed in a vessel, every time your heart beats, blood flows through your veins and your arteries, and it has the potential to break off and form what we call an embolus. An embolus is a moving clot. So you can have an embolus. If the embolus goes and lodges into one of the major vessels in your heart, you can have a heart attack. If it lodges into one of the major vessels in your brain, you can have a stroke. So to prevent those things, you can be given a blood thinner. There are things that are called immunologics. I don't know if you guys have heard about these monoclonal antibodies. Monoclonal antibodies, they're talking now about, because they know more about them, because the treatment has been going on now for almost a year, because we know more about monoclonal antibodies, they're beginning to think that treatment with these immunologics in the beginning of your illness can prevent the illness progressing to more severity, becoming more severe. And then, of course, ventilation support if your lungs are just completely overwhelmed by this virus. So Now I'm going to ask my husband again, do I have any questions that I need to address?
I don't see any.
Okay, no questions right now. I hope you guys are really enjoying this and that you are, please share it. Please share for people to get this information. So now I'm actually going to pause for a moment because I need to take care of dry throat. Because I suspect that the number one thing that people want to talk about or hear me talk about is the vaccine. So much has happened in the last week. So much has happened in the last year. I am a physician, but I am a scientist by training. Physicians, all physicians are scientists, and we love science, and it is my responsibility to relay to you what the science of this disease is.
I have one question.
Someone asked about COVID and pets and the mask with somebody who has asthma. So so very good questions. Okay, so someone who has asthma. If you have asthma, you have a pre-existing condition that affects your lungs. You do not want to contract this virus. It will not be good for you. So what you have to manage is your ability to breathe easily and wear a mask at the same time. So my question would be for someone who has asthma, is your asthma controlled? Because if you have asthma and your asthma is controlled and you wear a face covering, it's not going to induce an asthma attack. It's not going to exacerbate your asthma. If you have asthma and you wear a mask and your asthma is exacerbated, then you need to talk to your primary care physician about controlling your asthma, because that just should not happen. If you are in the midst of, let's say, you're allergic to pollen or pets or smoke, or if you get a regular virus and you happen to have a common cold, and that serves as a trigger for your asthma, then we know that primary thing will trigger your asthma. So if you're in the midst of an exacerbation, then don't wear a mask outside. But can you say, well, I have asthma, I have to go to work and I can't wear a mask? Or I have asthma and my mode of transportation to getting to work is public transportation, whether it's a bus or a train, or if you do a ride share, can you enter that bus, train, or ride share and say, oh, I'm sorry, I can't wear a mask, I'm excluded because I have asthma? No, that's not true. You would still have to wear a mask. If you're inside, and a lot of people say, listen, I just can't wear this mask all day. I get it. Go outside where there's fresh air. Take your mask off. If you're by yourself and you're not within 6 feet of another person and you need to take a break from wearing a mask, by all means, take a break from wearing a mask, but you need to do it responsibly. What it does not mean is that you're at work and you work around other people and you decide, I need a break from this mask, so I'm going to go in a break room because, hey, right now there's nobody around, or that you're going to go into the bathroom because there may be 3 stalls in the bathroom, or maybe there's one and there's nobody else in there, and you think you're going to have your 15-minute break in the bathroom, or your 15-minute break in a break room, and nobody's there, and take your mask off. Well, that would be irresponsible, because like I said, you can be an asymptomatic carrier and be spreading virus while you're eating, or taking your break in that place, in that space where your coworkers would then have to go behind you. So the responsible thing to do is to go outside. If you can, go sit in your car. Have lunch in your car. have a 15-minute break in your car. Wherever you need to go to take your face mask off, you need to do it when you are not around other people. That's just the responsible thing to do from a public health standpoint. I saw another question was COVID and pets. Okay, Kelvin, do you have another one?
Yes, the lady said I had a St. Jude valve on warfarin for 40 years. What vaccine affected this?
Okay, so the person who asked about having a heart valve and being on a blood thinner, which is warfarin, I cannot give you medical advice about that. You should contact your physician, your primary care physician, and they are happy to give you information about that. But I cannot give medical advice to patients, people who are not my patients. And even if they're my patients, because some of my patients' parents might be on here, I'm not going to give you medical advice on this Facebook Live either. Come see me in my office. I do have a medical license that I like to keep, just saying. And I say that with levity of heart. Please don't take me too seriously, you know. Jokingly, but serious. What are the ingredients in a vaccine? We're going to get to that. Now, COVID and pets. So for somebody who has the coronavirus, and you have pets in your house, the person who is infected should not be around pets. There is, I have this whole thing about pets. So we're going to talk about these pets. So, all right, so animals and COVID. So there are species that do get COVID. There are a small number of pets, including dogs, cats, and ferrets, that have been reported to be infected with this virus. Ferrets, there are research that shows that ferrets, cats, fruit bats, which is where we think all of this started, and golden Syrian hamsters have been experimentally infected with the virus and can spread the infection to animals of the same species. So cat to cat, ferret to ferret, hamster to hamster. This has happened in laboratory settings. Mice, pigs, chickens, and ducks did not become infected or spread the infection. So if you happen to be, like, in all honesty, if you happen to be on a farm where you have ducks or pigs or chickens, they did not spread the infection at all. And data from one study suggests that dogs are not as likely to become infected with the virus as cats or ferrets. Now, there have been large cats in captivity, like lions and tigers, specifically in the New York Zoo, a puma in South Africa, and tigers in the Tennessee Zoo that tested positive for the Sars Cov-2 Virus. Several gorillas in the San Diego Zoo were tested positive. They do believe that humans were the primary mode of infection for these larger animals. There have been some minks on farms in the Netherlands, Denmark, Spain, Italy, Sweden, and the United States that have been reported to have coronavirus. Again, the minks as well have been shown to infect other animals on the farm, namely cats and dogs. However, the infected farm workers were the initial source of the infection in these minks. Okay, so that's the question on pets. And some people say, you know, they have asked early on, should I go and get my pet tested for COVID-19? No, that should not happen. What is the salt intake in the vaccine, and can it cause increased blood pressure with hypertension? I will get to that. I'm going to give you a lot of information on the vaccine. So the best mask to wear for the person who has asthma would be the surgical mask. I wouldn't wear the fabric mask because it's less restrictive for your breathing. So if you can, just wear this type of mask. Anything else, Calvin?
Some guy wanted to know about taking care of the infected person at home. What vitamins or foods you want to take, for example, vitamin C, D, and zinc. Okay, so someone has asked about taking vitamins. Okay, so vitamin, and there was also something, some research that was found that people who are vitamin D insufficient and deficient have been more susceptible to this virus, and African Americans and black and brown people in general, you know, we have pigment in our skin, and the pigment in our skin keeps us from absorbing the sun in a way that the conversion of vitamin D is made from the sun to your skin, and your body can absorb it. So, which is why most black and brown people are vitamin D insufficient, if not deficient. We don't expose enough of our body in the sun. We don't tend to sunbathe, where you put on a bikini and go and lay in the sun and get your suntan. That's just not something that we who have pigment in our skin tend to do. We cover up when we go outside in the sun. And then a lot of people, no matter how much pigment in your skin, we're told to use sunblock. And when you use sunblock, that blocks the sun from doing what it's supposed to do, because the conversion of vitamin D is from the sun to your skin. It's not from milk. And so everyone, I think, this is controversial, but if you want to know your vitamin D level, then you have to go to your primary care provider and have a vitamin D test done, and then a supplement that you would take is vitamin D3. But like I said, that is something that you would have to talk to your provider about. But in terms of supplements, echinacea, elderberry, vitamin A, vitamin B, vitamin C, you know, zinc, you know, all of these things. So all of these things are very, very, very good to boost your immune system in general. And you should do these things in general during the cold and flu season, because it's going to boost your immune system, and it helps your immune system work better. What it does not do, they are not a treatment for this virus. So you cannot say that I have been infected with this virus, I'm going to load up on vitamin D, C, B complex, zinc, elderberry, echinacea, all of these things. So those things are good, but they are not a proven source to treat the coronavirus. So not a form of treatment. A better thing that you can do for your immune system is get enough sleep, exercise, and decrease the amount of stress in your life. To be honest, that is a better booster of your immune system. You know, try to do those things. Let's see. A lot of vaccine questions, so don't.
Yeah, a lot of vaccine questions. Vaccines are coming up. The ingredients of the vaccines.
That's it.
Does the vaccine have red cell lines in it from baby fetus? What's the difference between Pfizer, Moderna, and Johnson & Johnson? Okay, I'm going to talk about those. The person who asked about, okay, so the question about fetal tissue, the red cells, I am not a virologist, an epidemiologist, or a researcher, that kind of scientist. So I cannot tell you the specifics about how the vaccine is made in terms of what cells are used to grow and propagate the virus. I'm just not able to do that. And I can give you information about the contents in the vaccine, but not about the cell lines that were used in its production. Okay, so the first thing I want to say about this vaccine, and I will ask you for you to excuse me, because during this portion of my talk, I'm going to be I'm looking at a lot of papers because I have a lot of stuff that I have read in preparation for this. And like I was saying, so much has come out in the last week about these vaccines. Okay, so there are 3 specific types of vaccines right now. We have your messenger RNA vaccine, you have your vector vaccines, and then you have a protein vaccine. So we're going to talk about right now we're going to talk about the messenger RNA vaccine, because the messenger RNA or the mRNA vaccine is the type of vaccine that is that the 2 that are on the market right now. The Pfizer vaccine, Pfizer BioNTech vaccine, and the Moderna vaccine are both messenger RNA vaccines. And I am going to give you guys an immunological lesson on vaccines and messenger RNA. So just put your seatbelt on, because we're about to go. This is very exciting for me, and I really don't want to miss anything. So messenger RNA. Okay, so let me back up. This is where we talk about vaccine hesitancy. So most of the vaccines that have been made in the past are one vaccine for one disease. And when you do the vaccine trials, you have to do these phases, phase 1, phase 2, phase 3, phase 4. You do them in animal models, and then you do them in humans, and you do them in phases. Okay, so here we go. So when we're doing these trials, okay, so phase 1, first of all, preclinical trials. So the person who asked me about red blood cell lines and fetal tissues, this is called preclinical trials. So in preclinical trials, the testing is done in animals, and this specifically is done to see, does the vaccine produce antibodies? If the vaccine does not produce antibodies, remember we said that antibodies protect you. If the vaccine does not produce protective antibodies, it fails. Even in animal models, it fails. Does it protect against illness, and what dose is necessary? So when you do animal models and preclinical trials, you want to know, does this vaccine have the capacity to produce antibodies? Are these antibodies at a level that are protective? And at what dose should this vaccine be administered? Okay, preclinical trials. Then we have phase 1 testing, which is testing of a small number of humans. And it's about making sure if the vaccine is generally safe in terms of short-term side effects. Generally safe. First, does it produce antibodies? Is it safe? Okay, so vaccines, before they even come to market, the phase 1 trials are testing safety. So for all of you who have your reservations about, is this vaccine safe? Safety is phase 1 trials in humans. Okay, phase 2, more testing in humans. Does the vaccine stimulate a potentially protective immune response? Okay, before we even test to see if the immune response is significant, we test to make sure the vaccine is safe. This is not only for the COVID-19 vaccine, but this is for any vaccine that's out there, anyone. Okay, phase 3, testing in a larger number of humans to confirm, is it effective? Vaccine safety trials are done before vaccine effectiveness trials are done. So, for all of you who are not sure if the vaccine is safe, it is proven safe before it's proven effective. And then phase 4, after the vaccine has been licensed, ongoing surveillance to make sure it doesn't have long-term adverse events, and the studies are in special populations that often do occur. So right now, the Pfizer and Moderna vaccines that are out, the messenger RNA
vaccines that are out have been proven safe. They have been proven effective. Long-term adverse studies have not been done. Why have they not been done? Because this virus was first recognized in December of 2019. We are in January, almost February of 2021. We don't have 2, 3, 5, 6, 10 years of data to be able to tell you what's going to happen 10 years from now, 5 years from now. So all of you who are hesitant and who are saying, I'm not taking this vaccine because they don't know what's going to happen 5 years from now, I'm not being anyone's guinea pig. Well, there have been human trials already to show short-term safety and effectiveness of this vaccine. So as a scientist, as a physician, I'm excited about the research because right now the vaccine has been proven safe and effective, and the alternative to this vaccine is infection with Sars Cov-2 virus that causes COVID-19 disease. Those are our two options. You take the vaccine that has proven to be 94 to 95% effective in preventing clinically recognizable disease. 94 to 95% efficacy in preventing clinically recognizable disease. The Johnson & Johnson vaccine is a different type of vaccine that produces 62% that is 72%, 62 to 72% effective in preventing clinically recognizable disease. The Moderna vaccine and the Pfizer vaccine have also shown to prevent death from this virus. These vaccines have been proven to prevent death from 95% to prevent death from this virus. I think those odds are pretty good. The Johnson & Johnson vaccine has been shown. Okay, so this vaccine just came out. So there's some I don't want to say confusion, but some hesitancy. Okay, so how can this virus be, oh, well, it's only 62 to 72% effective, whereas the Pfizer vaccine and the Moderna vaccine are 95% effective, 94 to 95% effective. So why would I do the Johnson & Johnson? Well, the Johnson & Johnson vaccine is 85% effective in preventing severe disease and hospitalization and death. And so if it's 62 to 72% effective in preventing clinically recognizable disease, so if you say, okay, well, I'll get the Johnson & Johnson vaccine, it's only one dose, it doesn't have to be stored in liquid nitrogen, it can get to rural areas, it can be stable in a refrigerator for longer periods of time, it's only one dose. This vaccine has tremendous implications for excuse me, this vaccine has tremendous implications for public health surveillance and preventing the spread of this vaccine. We should be excited about this vaccine. We should be excited that there are people in remote areas who cannot come out to a hospital setting where you have liquid nitrogen, where you have the Pfizer vaccine. Okay, I'm gonna get the Pfizer vaccine because in 21 days I can get the second dose. Who's got liquid nitrogen in a rural area? The Moderna vaccine, there has to be, it's a vial with 10 doses. You know, we need to look at science and be enthusiastic about what is going on in the world of vaccine production right now. But I'm getting ahead of myself, you guys. So, excuse me. The messenger RNA vaccine, it's a new type of vaccine. So like I said, we are used to one disease, one vaccine, one disease, one vaccine, years and years and years of clinical work. So
I'm going to tell you what makes me so excited about this messenger RNA vaccine. And one of them is, oh my gosh, I don't want to get Dr. Kizzy's name wrong. Where is it? Okay, so we have a woman, Kesmikia Corbett. Dr. Kesmikia Corbett is a black scientist, and she is at the heart of Moderna's vaccine development. And so Dr. Kizzy, as she affectionately calls herself, like we're going to talk about the irony in that, Dr. Kizzy is at the head of the vaccine development for COVID-19, okay? So, you know, pick that one up. But anyway, she has been doing research on messenger RNA viruses. So, ladies and gentlemen, messenger RNA is new to this specific type of vaccine. The Moderna virus and the Pfizer virus is out, but the technology for developing this vaccine has been going on for decades. Decades, people. So the last presidential administration, Operation Warp Speed was put in place for the production and distribution of this vaccine, but it was not put in place for the development of the vaccine. So the Pfizer vaccine, the Moderna vaccine, the Johnson & Johnson vaccine, AstraZeneca, all these other ones that are out, these vaccines were not developed through warp speed since March, okay? So this vaccine, this messenger RNA vaccine. Okay, so do you know what a CASI is? A CASSIS? So a CASI is a framework. Okay, so if you can think of an automobile that's being developed. Oh, Cheryl, I see all of those hearts. Thank you, thank you, thank you, thank you. I can't read all of these things that are going through, and I am gonna go back and read what you say. But Minister Cheryl just put up like 15 pink hearts, and pink is my favorite color, and it just popped up on the screen, and I can see it from where I am. So thank you, thank you, thank you. Okay, so back to this. Okay, so think of it as a framework. And I'm going to give this analogy. So if you have a car has to be on a frame, right? So there's a frame, and then there's wheels, and then there's everything that goes into this car. So if you can imagine that messenger RNA, the framework has been in development for decades. So what do we do now? Dr. Kizzy says, oh, you know what? I've been working on this messenger RNA, and I think that the protein, because she was working on coronavirus development as well. So she was saying, well, you know, there's this protein that I've been working on, and perhaps I can take a code, a part of the protein that codes for a piece of the spike. So if you guys have seen images of this, the Sars Cov-2 Virus, it's round, and it has like these little spikes on it with a ball on the end. So a little spike with a ball on the end. Okay, that's a protein. And so what Dr. Kizzy and her team has done is that they have taken something that codes for a portion of the spike protein that is on the outer surface of this virus. You take that as the engine per se and put it in a chassis that's already developed for the messenger RNA. So you already have the framework for the car. All they did was develop the protein that's the engine in the car. So the only thing that's new is the engine. The basis of it has been in development for decades, okay, for a decade. And so now, so this is new. People, this is very exciting. Can you imagine having a messenger RNA vaccine where we say, okay, well, we have the framework for it. Okay, we're going to get this engine, and we're going to put it in here, and we're going to vaccinate against the Sars Cov-2 that causes that causes COVID-19 disease. Okay, well, you know what? There's another disease that comes up. Okay, well, you know what? Let's work on that protein, and we're going to take that engine and we're going to put it in this this messenger RNA vehicle that is already here. This is groundbreaking for the development of vaccines. And because so many researchers, you know, when this pandemic came and we had to shut things down, teachers couldn't go to school, researchers couldn't go to work to do research, because research is done in labs, okay? And when people are in labs, they're very close together. They couldn't even be close together. So people who were working on research for other viruses had to stop what they were doing and find something else to do. Do you know that the person who has come up with the website, Johns Hopkins University has a website that I'm sure the majority of you know about. You go to this website and it tells you in real time where how many people across the globe have been infected with this virus, how many people have recovered from this virus. The newscasters report things that are very sensational, okay? So this disease, this pandemic is very sensational. And everybody wants to know about how many people are infected, how many people are infected, how many people have died. Well, they don't report the number of people who have recovered, which is far more than the 400,000 that have died, far more from the millions who the 400,000 who have died. So millions and millions and millions of people have been infected with this virus, but hundreds of thousands have recovered, okay? The Johns Hopkins site, where you can get all of this information, you can go to this site and put in any country that you want, any state in the United States that you want. You can find the county that you live in. Like, it breaks it down that much so you can find out. The people, the biomedical engineers, technologists, scientists, whatever specifically that you call them, the people who came up with that were people who were not able to do their research because they were quarantined because of the pandemic. And now look what's come out of it. There is so much that's coming out of this pandemic. So much good is coming out of this pandemic. And the messenger RNA vaccine is a good thing that is coming out of that pandemic. But I still got you. People still have a lot of questions. Okay, so like we said, so what happens? How does this messenger RNA work? So now I've given you analogies. I talked about a Pac-Man. I talked to you about the antibodies, the B-cell antibodies that got your back. I talked to you about the T-cell snipers, the killer cells. We talked about a car. And so now we're going to talk about an egg. Okay? I'm going to talk about an egg because the messenger RNA is not a DNA virus, and it does not change the DNA of any cell in your body. Why? Because the messenger RNA goes into the cytoplasm of the cell and not the nucleus. So if you take an egg, okay, so let's take an egg, a raw egg. We crack the egg and you put it in a pan because you're going to fry it. The white part of the egg is white and the yolk of the egg is yellow. So if you can think of this egg in the frying pan as a cell, and the yolk of the cell is the nucleus where your DNA is, and the white part of the egg is your cytoplasm. Okay, so the messenger RNA vaccine injects a tiny portion, not even the entire protein. It's not a weakened COVID. It's not a weakened Sars Cov-2 virus. It's not a part of the Sars Cov-2 virus. It will not give you Sars Cov-2 and make you a little bit sick because it's a portion that codes for a portion of the spike protein. It in and of itself does not have the capacity to cause any illness. This vaccine will not give you COVID-19 disease. It will not. It doesn't have the capacity to do it, no matter how hard it may want to, no matter how hard it tries. This spike portion that codes for the spike protein could be like the little engine that could, going up and up and up the hill, chugga, chugga, chugga. I think I can, 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 I know I can, I did it. No. This does not even have the capacity to be the little engine that could. Okay, it just can't. Okay, so what does it do? Okay, so if you can imagine this messenger RNA, okay, so it is, somebody asked me what is in the vaccine. So there is these nanoparticles that are like lipids or fats that surround the messenger RNA. They have to be there to protect the messenger RNA. Otherwise, as soon as the vaccine is injected into your muscle and it goes into a cell, it would denigrate. It would be destroyed. So the messenger RNA is surrounded by this this fatty layer that protects the messenger RNA, and it also serves as an adjuvant to help it work better, which also is responsible for the reactogenicity of the virus, which I'll talk about later. But so it's necessary. So it only goes into the cytoplasm of the cell, and once it gets into the cell, it actually this is really, really good, and I've written all over it. This is from Pediatric News. It came out in January 2021, this month. So this here is what I'm talking about, and what I'm going to explain to you right now. So so you get the messenger RNA vaccine. It's surrounded by this lipid layer, this fatty layer. It gets injected into the host cell, and then it goes into these things that are called ribosomes, which are the blue things here. So the messenger RNA is the red part, and then it gets injected into a host cell, and then it goes through these ribosomes. Okay, so the ribosomes are in the cytoplasm of the cell, and if you can see this here, this is the nucleus. That's the nucleus of the cell. The nucleus of the cell is like the yolk of the egg yolk. Your DNA is there. The messenger RNA is in the cytoplasm. That's the white part of the egg. The messenger RNA is not going to go into the nucleus. It doesn't have the capacity to even do that. So it goes into these things that's called ribosomes, and then they get processed. And then once they get processed, the messenger RNA gets into the cell, and so when the cell multiplies, it takes the message from the messenger RNA and produces this spike protein. So remember I talked to you about immunology in the beginning and what our body does and how our bodies in and of themselves, when these germs come into our bodies, the macrophages eat them up, and then the B cells come in and they come to the rescue because I got your back, boy, and they produce the antibodies. Well, the messenger RNA is going into these ribosomes, and they're producing these spike proteins, and these little spike proteins are on the outside of the cell. And so when the body recognizes these spike proteins, these antigens come in and it attaches to them, and then the body's immune system, you have vaccine mediated immunity that's going to kill any of that virus that comes into the cell. So the messenger RNA, is just a code for people who do computers and who do coding. The messenger RNA just helps the body to code, to replicate the code for the spike protein to present an antigen presenting cell. So the spike protein is gonna present on the cell, and then your body is gonna come in, those cells that have memory, and then they're gonna say, I saw this before, and they're gonna fight it. So your body is gonna develop memory against these spike proteins. It only needs a little bit of something that's foreign, and your body's like, oh, this doesn't belong here. I'm going to get rid of this. And once I get rid of this, oh, I'm going to remember. I'm going to remember what this is, so that when it comes into my body again, guess what? All of these antibodies, we got you. We're standing at a fort. We're going to attack it. And if some of those antibodies don't do it, remember I talked about those T memory cells? Those two T memory cells are going to come in, and you have killer cells, and they are going to kill it. So this is why I started my entire presentation with your immune system. If you understand how your immune system works and how it's supposed to work, then you're going to understand how your body's natural immunity works with this virus. I'm sorry, with this vaccine. So the vaccine is safe, everybody. It's safe. It helps your body do what it's supposed to do to fight infection. So please, please, please don't be scared of this virus. So 8 things you need to know about the vaccine program. Okay, so I am going to talk about these vaccines. Okay, so the Pfizer vaccine is a vaccine that has this emergency use authorization. Okay, so it has been authorized for the emergency use for individuals who are 16 and older. 16 and older is the Pfizer vaccine. You get your dose, the first dose, and 21 days later you get the second dose. This is the vaccine that I received. The other messenger RNA vaccine that's out now is the Moderna vaccine. 18 and older, and your second dose is in 28 days. These vaccines are both messenger RNA vaccines, and they both work the same, okay? Different companies, okay, well, this one you get in 21 days. Is it better than the one that comes out in 28 days? Absolutely not. They're both messenger RNA vaccines. They both work just as well, but you know, just a little bit difference in when you get the booster. Okay, so and how they have to be stored. One has to be stored very coldly at on dry ice, so to speak, like minus like 70 degrees, and the other one can be in a refrigerator. But funny story. So there was, and I can't remember the state, somewhere where it's cold because it was already snowing. I want to say Utah, but I could be wrong. Somewhere out there. There was some healthcare providers who was doing a vaccine clinic, and they had to close the clinic early because a snowstorm was coming. Snow was already falling, but they had to close early, and so they had the Moderna vaccine. And with the Moderna vaccine, you have a vial that has 10 doses in it, and I believe it was 6 doses that they had left over in this vial, and they were going to be on their way to another vaccine administration site, and they were going to be able to give these doses. They have 4 hours that they were going to be able to have to use these doses. Well, as they're traveling, the snow is falling more heavily, and they're realizing we're at least 2 hours away and we're in bad traffic. We do not want these doses to go bad. So what did they do? They got out of their cars. Now, mind you, there was a physician there. There was an ambulance that was stationed at their vaccine site. They had ancillary workers there. They had all the paperwork for them to fill out, you know, the information. They had everything. You can think of it as kind of like a traveling vaccine clinic, right? They had everything, but they did not want these 6 doses to go away. So they're knocking on doors of these people's windows, and some are like, no, thank you, go to the next car. And there was one man who was very upset because he really wanted the vaccine, and he thought he wasn't going to be able to get it. And he was like, this is a godsend. He thought it was a joke. Are you serious? Are you serious? I can get this vaccine? They said he had his shirt off before they could even get all the paperwork done. So it was real, and they vaccinated 6 people. 6 people because they didn't want these doses to go to work. I mean, that's fantastic to me. That's just absolutely fantastic. And there was one woman who even took the doctor's ID and held up his ID with him and took a picture because she was serious. She was like, I'm gonna get this vaccine, but I'm gonna make sure you're not doing nothing wrong too. So anyway, I don't even know how I got off on that tangent. But anyway, so these vaccines are both messenger RNA vaccines. Oh, and I was telling you, how they had to be stored, and for different reasons, this is how they have to be stored. But they're good vaccines. Now, the reactogenicity. So the reactogenicity is the reaction that you have after you receive one of these vaccines. So, like I said, let me slow down. I received the first dose of the vaccine on I can't use my phone. It was the Sunday before Christmas, whatever date that was. So I received the vaccine on a Sunday, around 2 o'clock in the afternoon, 2 o'clock, 2:30 in the afternoon, on a Sunday, Pfizer vaccine. So 3 weeks later, on February the 10th, which was also a Sunday, I was scheduled to receive the second dose. So I received the first dose at 2:30 in the afternoon. That evening, I was watching Sunday Night Football, and my son Joshua was laying against my arm, and I thought, that's a little uncomfortable, but not so uncomfortable that I asked him to move. I went to bed that night, woke up the next morning, and my arm was a little tight, hurt a little bit. I was on vacation that week, so I didn't have to go into work. So when I woke up, I took a nice hot shower and waited, and the symptom went away. So that was the first dose. The second dose, 3 weeks later, so it's also on a Sunday, but this time I'm not on vacation. And, I wasn't thinking when I got the first dose on a Sunday that the second dose I wouldn't be on vacation, I would have to go to work. So nevertheless, I received the dose again, 2:30 in the afternoon, was completely fine. I went to bed. I was right before my alarm went off, so I would say around about 6:30 in the morning, I rolled over and my arm hurt. And it actually woke me up out of my sleep because my arm hurt so much. And I was like, wow, didn't feel like this last time. Nevertheless, got in the shower, took a hot shower, and I said, okay, I'm going to be okay, and I'm going to just go ahead to work. So I got to work, and it was like 9 o'clock, and I was like, this is really not good, because now I have a headache. My body is hurting so bad. Like, I had so much muscle ache, and I had nausea. I took my temperature. It was 98 something, so I definitely did not have a fever. But I went to my office manager. Now, there are 4 other physicians in my office on Monday morning, and I asked her, I said, I'm really not feeling well after the second dose of this vaccine. Could you lighten my schedule, probably just until 11 o'clock for 2 hours. I'm going to take some ibuprofen, and I took some Zofran, which is medicine that you take for nausea. So I said, let me just take that, and I'm going to give myself 2 hours, and then, I'll be really good. I can still see patients. I'm not sick. I just don't feel so well. So my load was lightened, and by 10:30, I was like, oh, I'm good. All right, an hour and a half into my medicine, I was good. I was 95% back to myself, seeing my patients with no problem. I went to the bank at lunchtime. I went to get some whatever. I'm not going to name the restaurant, but I went to a restaurant and got some lunch and came back into the office. Now, this is about 1:30. I'm still feeling good. My office hours began at 1:30. I started seeing my patients, and by 2 p.m., bam. Well, now we're like at 24 hours after the vaccine. Bam, hit me like a truck. If I had closed my eyes, I think I would have fell asleep in front of my patient. But the headache was back, the nausea was back, I was chilled down to my bones, and my body was just absolutely aching. So I took some more ibuprofen, I took some more Zofran, in another hour I was fine. I finished seeing my patients. By 6 o'clock, I was home. I did get in the bed. I did not go to sleep because I wasn't sleepy, but I just needed to rest. So I got in the bed. My husband gave me soup and crackers for dinner, and the nausea went away. But before I went to sleep, I took another Zofran, and I took naproxen because I didn't want to be interrupted in my sleep. I wanted 12 hours of pain relief. So I took the naproxen. I woke up in the morning, I was 100% better, 100% better. So my symptoms began, I want to say about 12 to 15 hours after my second dose. And then by the next morning, they were done, and I was fine. So this is what we call reactogenicity. Reactogenicity means that my body's immune system is reacting to that protein derivative that was injected into my arm. Now, when I had that local reaction the first time, that's a reactogenetic reaction as well. So if you have a local reaction, some swelling, some tenderness, even a low-grade fever after the first dose,
do not be alarmed. Your body's immune system is reacting in a way that it should. Reactogenicity is, of course, greater after the second dose because your body is being exposed to this protein derivative yet again. So this is why they say if you receive the vaccine, try to have 2 days where you don't have to go to work. If you have to go to work, okay, but they try to say 2 days. And this is also the reason why when healthcare workers receive the vaccine, if you're working on a certain unit or in a certain section, they don't want everybody getting the vaccine on the same day because they know you'll go on the same day, 21 or 28 days later to get your second dose, and you might have this reaction. We want our immune systems to react to this vaccine. Now, if you don't get any of these symptoms, does it mean that your body is not responding and that the vaccine is not working for you? No, it absolutely does not mean that. Some people are just more reactive than other people. Some people's immune systems just mount a stronger, more hardy response than other people's. But it doesn't mean that that the vaccine is not working for you. So I don't want you to think that that would be the case. So it's just that your immune system is putting your body on high alert and it's producing what we call polyclonal antibodies. So remember when I said that now if you're sick and you have to go to the hospital, that one of the things that they're finding out will work for you is a monoclonal antibody. Monoclonal antibodies can be made to produce, I don't want to be too, okay, y'all aren't physicians or scientists. Okay, monoclonal antibody means one antibody that you can use to inject into a person to help them if they've been infected with the virus. Your own body produces monoclonal antibodies. Polyclonal. So poly is more than mono. Mono means one, poly means many. So you would want your body to produce polyclonal antibodies to protect you more than the monoclonal. So the only thing we don't know about this vaccine right now is the durability of your immunity. People have been asking, if I get this vaccine now, am I going to have to get it over and over and over again, say 2 years from now, every 5 years? We just don't know. The scientists just don't know. Can we please just sit back and let science do its thing? This is what research is for. This is exactly what research is for. So we don't know right now. Dr. Fauci says he suspects the durability is at least 2 years, okay? At least 2 years. So, or better than 2 years is what he said. So we can just at least sit back and be hopeful that the durability of this vaccine will last for at least 2 years. So what about women of childbearing age? Dr. Kizzy said that during the clinical trials, there were women of childbearing age who received the vaccine during the clinical trials. And of course, they were instructed, you probably shouldn't get pregnant just because, pregnancy isn't one of the things that we're testing right now, or this vaccine in pregnancy isn't one of the things that we're testing right now. But there were women who did get pregnant while they were in the study and delivered healthy babies. There was no effect on a developing embryo or fetus during the vaccine trial. So that is that. Now, I wanted to give you a couple more specific things about the vaccine. Like I said, can COVID-19 vaccine make me sick with COVID-19? No. And I explained to you that the vaccine does not contain any live or weakened viral particles. It's just a portion of the spike protein that's coded for. After getting the COVID-19 vaccine, will I test positive for COVID-19 on a viral test? And that is a no. Remember, I told you a viral test is an antigen test and it looks for current infection. Because you are not currently infected when you receive the vaccine will not cause you to have a positive antigen test. If I already had COVID-19 and recovered,
do I still need to get a vaccine for COVID-19? Yes, you do, because we do not know how long your natural immunity will last. So it is best for you to have natural immunity and vaccine-induced immunity to prevent the infection in you again. Okay, will a COVID vaccine protect me from getting sick with COVID-19? And the answer to that question is yes. That's the whole reason why the vaccine is being recommended. Will it alter my DNA? I told you no. And is it safe for me to get the vaccine if I would like to have a baby one day? The answer to that question is yes. The question that I cannot answer, and that I would refer you to your gynecologist or your obstetrician, is if you're planning to get pregnant, how long should the wait be? I have read some literature that says if you're planning to get pregnant, what you should do is get the vaccine, get your second dose of the vaccine, wait 2 months, and then try to conceive. So that's the literature that I have read. Any questions, specifics beyond that, you will have to consult your own gynecologist, obstetrician. Okay? Somebody asked about salt in the vaccine. There's no, I do have a list of there's a fact sheet that you will get if you're going to get the Pfizer vaccine or the Moderna vaccine. There is a fact sheets plural that you will get about the vaccine. It talks about the reactogenicity that I talked about. Although it doesn't use that term, it uses it as in side effects. It talks about the ingredients that are in the vaccine. There is one thing that I think that is really important for me to talk to you about, and I got this from the CDC website, and it's called Be Safe After Vaccination Health Checker. Be Safe After Vaccination Health Checker. I think that this is very, very important, and you will go to vsafe.cdc.gov. Now, you have to have received the vaccine to enroll in VSafe, and this is a really good tool that they will use to track reactions after this vaccine, and it's really good. It uses text messaging and web surveys to provide personalized health check-ins after you receive a COVID-19 vaccine. I can tell you that I registered for this after I received my vaccine, and I received a text message at around 2 something every day when they did it on a daily basis. It was around 2:30, the same time I got the vaccine, and they would ask me questions about how I was feeling. Like it takes you less than 2 minutes to answer the questions. And I answered it after the first vaccine, where they texted me every single day. After the first week, it went to once a week until I got the second dose. It actually also sent me a reminder to get this, that I was registered for the second dose. While I was receiving the second dose, I received a text message from VSafe that asked me, "Did you receive the second dose of your vaccine today?" So it reminded me to have the vaccine, and once I said yes, then it automatically logged in my lot number and things of that nature. And then again, after the second dose, the next day, the same night, it asked you about symptoms. The next day, I had some symptoms the second go around, and I was happy to report them. And the next day, and the next day. And so now, don't quote me on a specific timing, but it is my understanding that this VSafe Health Checker will track me for 1 year. It'll get to the point where it's once a week, and then I think it goes to once a month. And I think that this is very important, because this is actually part 4. If you receive this vaccine and you take part in VSafe, you are actually taking part of a part 4 clinical trial. So part 4 clinical trials are those trials that let you know how safe this vaccine is, what adverse effects might be present long term. So if you want to be a part of good scientific research after you have this vaccine, please register for VSafe. Now, another thing people have asked me is about allergies and this vaccine. If you have seasonal allergies to pollen, grass, trees, weeds, cats, dogs, shrimp, peanuts, walnuts, eggs, you should have no reservation with taking this vaccine. I don't. Whoa. Hold me on eggs. I believe that you can have it if you are allergic to eggs. I don't know if I'm going to find that right now in a moment, but I think I did read that. Contraindications to receiving this vaccine. Where am I? Okay, so this is the Pfizer vaccine. Oh, okay. So the Pfizer vaccine does not contain eggs, preservatives, or latex. That's the Pfizer vaccine. The Moderna vaccine does not contain eggs, preservatives, or latex. Okay? So what it does say is, I also want to tell you guys about the demographics for these two vaccines, these messenger RNA vaccines, Pfizer and Moderna, in terms of, I have chronic conditions. I don't think I should take this vaccine. Okay, so let me get this right. Okay, so the Pfizer vaccine, both the vaccines and their demographics were pretty, for Black and brown people, although I'm going to tell you for all, were pretty consistent with what our percentages are in the general population. So for the Pfizer vaccine, in the trials, you had 82% white, they're 60% of the general population. 26% Latinx, they're 18% of the general population. 9% African American, 13% of the general population. 4.4% Asians are 6% of the general population. And other races that make up less than 3% are 1% of the general population. So we were well represented in these vaccine trials. Yes, we're 13% of the population, but in the Pfizer trial and the Moderna trial, we were 9 to 10% of the vaccine participants, which I think was really good. You had equal ages, equal male and female, and in the Pfizer trial, 21% of the participants were 65 and older. In the Moderna trial, 23% of the participants were 65 and older. But one thing that I thought was interesting is the most frequent underlying medical condition for the Pfizer trial was obesity, 35%, diabetes, 8%, and pulmonary disease, 7%. So obesity, diabetes, and pulmonary disease were the most prevalent pre-existing conditions. For the Moderna trial, 82% of those who were in this trial were occupational risk exposures, with a quarter of them being healthcare workers. So a lot of people, which I thought was interesting, and I don't know why that is, but Black and brown people were very well represented in these vaccine trials. We could be better represented, but we were definitely well represented in the vaccine trials. Now, for both of these vaccines, there are some contraindications to the vaccine. So I was talking about allergies to foods, nuts, cats, dogs, trees, grass, whatever. The shellfish does not have anything to do with this vaccine. If you are allergic to any component of the vaccine does contain something that's called polyethylene glycol. So if you are allergic to polyethylene glycol, which you would know if you were, it's not a question, you should not receive this vaccine. If you received any vaccine in the past and had an anaphylactic reaction, lightheaded, dizziness, tachycardia, fainting, had to have an EpiPen, you know if you had an anaphylactic reaction. If you have never had an anaphylactic reaction to any other vaccine in the past, there's no reason to believe that you would have an anaphylactic reaction to this vaccine. So, if you have had an anaphylactic reaction to any vaccine in the past, you are not recommended to receive this vaccine. Okay? If you receive the first dose of this vaccine,
and you had an anaphylactic reaction to the first dose of the vaccine, it is not recommended that you receive the second dose of said vaccine. That means if you had a reaction to the Pfizer, don't get in line for the Moderna for your second one, because they're both messenger RNA vaccines and they should not be, you should not receive it. So those are, now this is from Moderna and from Pfizer, those are the absolute contraindications to receiving this vaccine at all in terms of allergies. Any other contraindication, any health risk, any medication that you're on, you would need to contact your primary care provider to see whether you should receive the vaccine or not. So now I was reading something about the Johnson & Johnson vaccine, and you have to forgive me because I was just reading this information on Friday. I'm not gonna really go into the specifics of how the Johnson & Johnson vaccine was made. It's not a messenger RNA vaccine, but like I said, it does present 85% of severe disease and death. 85% of severe disease and death. It's not 94, it's not 95, but 85 is a good number. I would recommend the Johnson & Johnson vaccine. There are other vaccines. Let's see, the Johnson & Johnson vaccine actually started their phase 3 trials as a single dose back in September. So that's when they started their trials, and now they're going to have to go to the FDA for emergency use authorization, which has nothing to do, it's a totally unbiased, unrelated source than the CDC or anything like that. It has nothing to do with the people who develop the vaccines. So you do not receive favoritism because you're Johnson & Johnson or Pfizer or Moderna or anybody like that. No favoritism. Okay, it is a spike protein. Oh, but it uses an adenovirus. So this is the Johnson & Johnson virus is one of those vector viruses. So it has to be attached to another virus to gain access into your cell, into your cell for the immune response to take place. So that is a vector type virus, not a messenger RNA virus. Different. Okay. There is also Sanofi and Novavax have a vaccine that's coming out. They have some clinical trials. GlaxoSmithKline has some clinical trials. There's some other pharmaceutical companies that have clinical trials. Oh, somebody asked about the Merck vaccine and why the Merck vaccine they stopped their trials. I read something about that, and their vaccine was found to not produce a suitable immunological response. So remember I said that the vaccine had to have a significant level of immunogenicity. The Merck vaccine did not meet that level, so they actually pulled their vaccine out of trials, and they instead are actually doing research for therapeutics to treat the virus should you be infected with it. So vaccines prevent viruses, but the therapeutics are for treatment, and that's the angle that Johnson & Johnson is using right now. So I've said a lot. I'm going to, but I'm not done. I'm not done. I do have some questions.
May I ask it?
Yeah. Okay. Kelvin's going to tell me some questions.
One question was, who gets to decide which vaccine a person gets?
Okay. Who gets to decide which vaccine a person gets? I think that first somebody had asked also a question about distribution and why the vaccines are not being distributed to the inner cities, that they're in the suburbs. I can't speak about distribution because that's not a question that has to do with science. So I can't speak about that. But how do you decide, who decides which vaccine you receive? I think that has to do with where you go to receive the vaccine. And it's just as simple as that. You are not going to receive a Pfizer vaccine at your local pharmacy if the local pharmacies are going to be giving vaccines, because they're just not going to have a significant amount of liquid nitrogen to be storing the vaccines at such a cold temperature. So I don't think
Don't get tripped up on, well, I want the Pfizer because it's every 21 days, or not every, but the booster is in 21 days. Or I want Moderna because it's, 28 days. Or actually, I want the Johnson & Johnson because it's only one dose. No. Wherever you go to receive your vaccine, you have to receive the vaccine that is there. If you have a preference for which vaccine you would like to receive, then you can do your homework and you can ask around for what vaccine are you guys giving out, and then you can make your decision in that way if it's that important to you. Also, my father had a difficult time where he lives in Georgia, dialing telephone numbers for where you can go to get on a list to receive the vaccine, and 211 is one of the numbers that you can call from wherever you are, 211, and they will actually direct you to where you can get information for the state where you are in, so that you can register to receive the vaccine.
Okay. Next question. Mm-hmm. The person want to know if they had the virus after the shot, can you get the virus again?
Okay, so if you had the virus after the shot?
Prior to.
Okay, so yes, I answered that question. So, okay, so let me talk some more about that. So, so when you receive the vaccine, and this has happened, there have been people who received the vaccine who contracted the virus. And let me explain to you how that happens. This is your body's immune system. Day 0, you receive an injection into your arm. You produce some protection, maybe 20 to 40% protection after that first dose, which is the reason why you need a second dose. So if you get this vaccine and you're not getting your booster dose for 21 or 28 days later, and still after that 21 days or 28 days, your body still is going to need a good time to form good antibodies, could you in fact become infected with coronavirus, with Sars Cov-2? Yes, you can, because your body just didn't have a chance to mount the immune response. So does it mean the vaccine failed? No, it does not mean the vaccine failed. It just means that your body is still in a process of mounting an antibody response. And also, okay. Next question.
Can taking Tylenol prior to work for the reactions?
Okay. Yes, you can take. Okay. The question is, can taking acetaminophen prior to your second dose or even your first dose blunt the reactogenicity, or those I don't want to call them adverse events because they're not, the reactogenicity of the second dose of the vaccine? Yes, it can, but should you is the better question. So we know that yes, you can take an antihistamine like Benadryl, Claritin, Zyrtec, Allegra. You can take acetaminophen for the pain. You can take ibuprofen for the pain. You can dose yourself 1 to 2 hours before the second dose to help prevent those experiencing those symptoms. But I would caution you not to, only because you want your body to mount an immune response to something that's foreign to it. And so I don't think that blunting that response is the best thing for you to do, especially for people who are already immunocompromised. There are some people who have some pre-existing conditions that render them immunocompromised, even if it's a small amount. So whatever immune response your body can produce after you receive the vaccine, I think you should allow it to do it, because it's just a good thing for your body. So if you're really scared about it and you don't want to experience those symptoms, then go ahead and pre-treat yourself. But if you can just anticipate that maybe 24 to 36 hours after the second dose you might have some discomfort, try to prepare yourself for that and manage the discomfort after the fact, but not before the fact. If you can stick it out and not treat yourself in the midst of the discomfort, if I were not at work after I received my second dose, if I were home on vacation or not even on vacation, just home for 2 days, knowing that this is what my immune system is doing to work, I would have wrote it out. I would have written it out. I would have written it out. Next question.
What are the side effects of both vaccines?
Okay, I discussed the side effects of both the vaccines. That's the reactogenicity, the headache, the fever, the chills, the body aches, the nausea. Those are all short-lived side effects.
That's it.
Okay, I do have some questions, and I wanted to put a pin on something. Who decides which vaccine? What is the possibility the vaccine can trigger unknown allergic reactions? We talked about it. Where can you get the vaccine? And that's what I said. You know, try dialing 211. Go to your local, the website for your local health department, because they can also let you know where you can go to get the vaccine, to get on the list. But I just ask everybody to just please be patient. The majority of these of Americans want the vaccine, and they want it yesterday. So just please be patient. But there are some things that I wanted to address about this vaccine. So there have been some people who received the vaccine who passed away. And I'm sorry, I'm just looking for something I want to say at the end. Okay, so there have been some people who received the vaccine after the first dose who passed away. There have been some people who received the vaccine after the second dose and passed away. So I really want to caution you all, when you are on social media and you are reading and sharing scientific information that has to do with people dying after the vaccine and using it as your reason for not getting the vaccine. So let me just say this. People die. People die all the time. People who are participating in vaccine trials die. People who receive vaccine will die. The question that you have to ask yourself, and what you have to look for when you're reading scientific journals, or if you're reading a report that somebody has, like if it's in the New York Times, or if it's in some, I don't know, local newspaper or something, what you really have to look for is cause and effect. Because if somebody took a dose of a vaccine and 4 days later they died, or 60 days later they died, what you have to do is you have to know, like, was there causality? Was this person's death caused by something that had to do with this vaccine? And I submit to you that the number of articles and that people are posting and sharing, a lot of times the person hasn't even been deceased long enough for an investigation to be done to say that there was a cause and effect. For instance, there was one, I don't know if it was a physician, I'm going to say a healthcare provider of some sort, who was in a state, a southern state, who received the vaccine, who ended up going to the same hospital where he worked, and was admitted with bleeding. He was bleeding, and his condition ended up worsening. He ended up having a stroke, and then met his demise from there. So in reading this particular article as a physician, to me, it seems like the person had a condition that's called ITP. So can you say that the vaccine caused this condition? No, you cannot. What you can say is this person developed a condition where the platelet counts were low, so he was not able to form clots. So when he was bleeding, he quote unquote like bled out, and he passed away. So there's no evidence that his condition was caused, instigated, exacerbated by the vaccine. And I can't remember if he had the Pfizer or the Moderna vaccine. but it was definitely one of the two, but they're both messenger RNA vaccines. So we can't say that. Apparently there was a famous person, somebody questioned, who died like 4 days after the vaccine. But like I said, there is an appointed time for everybody to die. There is an appointed time. And because so many people are going to be receiving this vaccine, you're going to learn of more people who died who happen to have received the vaccine. But I really caution you, cause and effect. And there was one article that a person, I have a screenshot on my phone, but I'm using my phone for video. But there was an article that someone shared with me that just came out on Friday about a person who had passed away. And I read the article, and at the beginning of it, the author of the article put an editorial comment at the beginning of this article, an editorial comment to say, something along the lines of, we have not found that this vaccine caused this person's demise. It's still being done, it's still being investigated or whatever. But they put a disclaimer, an editorial disclaimer. And you know what? That was the responsible thing to do, because as an editor, you cannot produce material that you have out, that you're responsible for as an editor, that's false or that's misleading. So the responsible thing for that editor to have done was to put an editorial disclaimer, and I applaud them for that. Okay. So that's the whole thing with these vaccines, causing death. I have, okay, thank you for sharing that. What is the possibility that the vaccine can trigger unknown allergic reaction within the body? And that's what I was, explaining to you all. And yes, this I just received the healthcare worker who died after receiving the second COVID vaccine shot. And the official cause of death was pending. Yes, this was in Santa Ana, California, the one that was just posted. And when you read the article, there is actually a disclaimer that was posted there. So that is good. But now I want to have a little bit of fun with you guys. Okay, so I've been talking a lot, and if people have hopped on and hopped off, I understand. But I just want to be thorough. I am thoroughly enjoying myself, and beyond my enjoyment, I hope that you are getting some good information. So I'm just going to go over some quick facts about the vaccine, hopefully some myths that I have been able to dispel. The COVID vaccine is caused by a virus, not a bacteria. That's why antibiotics don't work. Does the new coronavirus affect older people, or are younger people also susceptible? And we know that this vaccine infects older and younger people. As a pediatrician, I see patients up to a young adult, and I have seen infants who are positive with this virus, up to young adult college students who are positive with the virus. Fortunately for me, and most pediatricians, I think that we can say the majority of our patients who are infected with this virus can be taken care of at home with over-the-counter medications to reduce the symptoms. And that's just a matter of fact in the pediatric population. And I would go so far as to say in the adult population, I'm pretty sure my adult colleagues are also seeing the vast majority of people who are infected with this vaccine recover at home. Most people who get COVID-19 recover from it. Yes, that's what I just spoke. The new coronavirus cannot be transmitted through mosquito bites. I imagine that this was something that came out over the summertime, but we talked about large and small droplets and aerosols, so coughing, sneezing, things like that. But this is not what we call an insect-borne, that's B-O-R-N-E, an insect-borne infection, okay? Fact, COVID-19 is not transmitted through houseflies. Here's one that's interesting. Can shoes spread the COVID-19 virus? As a precautionary measure, the likelihood of COVID-19 being spread on shoes and infecting individuals is very low. So I know a lot of people like for you to take to remove your shoes when they enter the home. Like some people do that for themselves. Other people like to do it for visitors into their homes. But the likelihood of it being on shoes and infecting an individual is low. So if you want to leave your shoes at the door, go right ahead. Can COVID-19 be transmitted in areas with hot and humid climates? Absolutely. Heat does not destroy coronavirus, COVID-19. Heat does not destroy COVID-19. So if you go on vacation because you want to get away, if you go on vacation to a sunny place, you still have to be concerned with coronavirus. And also, another thing about coronavirus and vaccine, I put a pin in this and then I forgot to go back to it. So people ask, well, you know, if I receive the vaccine, especially my second dose, why is everybody saying that we still have to mask it up? And why are we still going to have to be physically distant? Wash our hands. Well, you should wash your hands anyway, because that's the number one way to prevent disease, any disease. Wash your hands, wash your hands, wash your hands. But the reason why you still have to remain masked, even if you receive the vaccine, is not to protect you from the virus. It's to protect someone who is not vaccinated from the virus. Because remember, the virus can still be in your nasopharynx, which is your nose and the upper part of your throat. You can still have live virus and be shedding virus in your nasopharynx. So this vaccine is going to prevent you personally from getting sick. The vaccine will prevent you personally from getting sick from the virus, but it will not prevent you from harboring the virus in your nasopharynx and spreading it to somebody else who hasn't received the vaccine, hence asymptomatic carrier. So you don't want to be your own super spreader event, you know, n equals 1. So you want to be careful. So this is the reason why they're still saying until we get a significant amount of herd immunity, you still have to mask up. And people are asking about this herd immunity too. Like, what is herd immunity? So when you get herd immunity, it means the vaccine has the virus has nowhere to go. So if I receive the vaccine and I'm around a lot of people who receive the vaccine, and then you have a subset of people in the community who were infected with the virus who have immunity, but we don't know for how long. When you combine the people who have natural infection, natural immunity, with those who have vaccine-associated immunity, when you get all of those people together, that's called a herd. And when you have herd immunity, when this virus is in the environment, it doesn't have anywhere to go. It doesn't have a host. It doesn't have a person that it can infect. So this is what we call herd immunity. So yes, you still want to continue to wear a mask because you don't want this virus to have anywhere to go. And the other thing that I want to talk about are these mutations. So we have the mutations that are from South Africa and from South Africa and from China, and there's another one. Oh, I'm so sorry. I had the information because I didn't want to misspeak, and I have so much in my head right now. But there are 3 different ones, and they're wondering if these variants or the mutations or variants, whatever you want to call them, if the current vaccines are going to be effective against them. So let me just say this about viruses. When viruses are in your body, they are going to mutate. Okay, they're going to mutate. They're going to change. If you are infected with this virus and you get your blood drawn and they did the genetics on this virus, they'll see one thing. They can take your blood 2 days later and look at the virus too, and it will have changed. So the viruses mutate in your body. The question is, how significant are these mutations? in how significant are they, and to what degree are they going to multiply and become the predominating mutant that's in the community? So that's what you want to look for. So right now, you know, these mutations from other countries, like I said, the newscasters and reporters they're sensational. They like to report things that are sensational. Yes, the UK, thank you. They like to report things that are sensational. So, there's a mutation. It's from the UK, and it's from China, or it's from South Africa. It's a mutant, it's a mutant, it's a mutant. That's sensational to the layperson. To a scientist, yes, it's a mutant, no big deal for now. So it's about 1 to 2% of the circulating strain that's in our country. So it may be more transmissible, which means it's easier to go from person to person. But because it's more transmissible does not mean that it's more infectious, okay? So just because you get infected with this mutant strain doesn't mean that you are going to be any more sick than you are with the strain that's already out in your community or in this country. So I don't want you guys to be, thinking, oh my gosh, well now we have this vaccine and it's not going to work, and what are we going to do? Is everybody else just going to have to get another booster shot? Do not be stressed. That's just a level of stress that your immune system does not need to be challenged with. Okay, don't worry about that. There are scientists who are concerning themselves about that. What you need to do is be informed, but what you need not do is be worried. Okay, no more stress, no more anxiety about those. Those variants will be there. The natural tendency for any virus is to variate. Not to worry about that. So so not to worry about that. Another thing about variation, let me just talk about influenza. There's so many people who don't receive the seasonal influenza vaccine. They just don't. If you do, you do. If you don't, you don't. So the influenza vaccine, it mutates, it varies, it changes. So every single year, there is a new seasonal flu vaccine. There are some strains of this current 2021 seasonal flu vaccine. There are some components in it that were in the vaccine for the last flu season. So because the flu virus itself changes so much, this is the reason why you have a different vaccine every year. And the flu vaccine is like 40 to 60% effective. 40 to 60% effective for really, really bad disease. So even though it's less effective than these messenger RNA viruses, and influenza is actually being considered to be the engine into one of these messenger RNA vehicles. So there's different viruses that can be considered. It's so much easier, so much quicker to make vaccine if you can put it into a messenger RNA. So that's something that the scientists are working on. But for right now, even though the flu vaccine is only 40 to 60% effective, if you have asthma, if you have any chronic medical condition, and it is detrimental for you to naturally be infected with influenza virus, I implore you to receive the vaccine. Wouldn't you like to have a 40 to 60% chance of not being infected with influenza if you have a chronic condition, and that if you are infected, that you are not going to be as sick as if you had not received the vaccine? That's just food for thought. And another thing about this, the COVID vaccine that I was talking about in terms of, can you still catch the virus even after you got the vaccine? Yes, you still can get the virus after you have received the vaccine until you have received the second dose and your body has boosted an appropriate immune response after having received that second dose. So again, even after you receive the vaccine, still wear your mask, still socially distant until you are protected. Then you can say, I am protected. I have 2 doses of this vaccine. I'm 3 weeks out from my second dose. I have immunity, I feel good. And the vast majority of people who receive the vaccine are breathing a sigh of relief just for themselves. But like I said, asymptomatic carriage is still a thing. And so until we have herd immunity where enough of people are immunized, then we still have to, we would still have to worry about that. Okay, so I have another question.
Yeah. The person wanted to know, would it increase your cholesterol or blood pressure?
Will it increase your cholesterol, blood pressure? There is no indication that any vaccine on the market will increase your blood pressure or your cholesterol. Okay. All right. So now back to some more fun things. Okay. Okay. So we were saying that COVID-19 can it be transmitted in areas with hot and humid climates? And we say yes. But I also want to say, yes, it can be spread in hot and humid climates, but it can also be spread in really, really cold climates. So it's ubiquitous. It's just everywhere. So it just needs a host. And the other thing about vaccine and hosts, viruses are pretty smart. So it is not the goal or the main intention of a virus to infect you to your death, because viruses will not survive if they're in a host and the host dies. So it is not their goal to cause death. It is their goal to cause infection to a low enough degree that they can multiply in your body and be spread to somebody else. So they want to get in you. They want to have their party in your cells. They want to get in there. They want to multiply, and they want you to spread them to other people. That way, that virus has place in the community. And that's what the virus wants. It wants to have a place in the community. It doesn't want to be so virulent that it kills you, because then it itself will not survive. Viruses are smart, okay? All right, now, there was some question about 5G mobile networks. Well, 5G mobile networks do not spread COVID-19. Viruses cannot travel on radio waves or mobile networks. COVID-19 is spreading in many countries that do not have 5G mobile networks. It is spread through respiratory droplets when an infected person coughs, sneezes, or speaks. So, or if it's on something contagious. So the 5G network, I'm telling you people, this is information that I got from the CDC. So it must be out there. So we got all these 5Gs. So the virus is not attaching itself to radio waves. That is a myth. Exposing yourself to sun or to temperatures higher than 77 degrees Fahrenheit does not prevent nor cure COVID-19. So don't go sunbathing, don't go sitting in those hot saunas, because it's not going to prevent or kill this virus. Okay, cold weather and snow cannot kill the coronavirus. Thermal scanners cannot detect coronavirus. Thermal scanners are effective in detecting people who have a fever. They cannot detect coronavirus. So if you go places and they want to take your temperature before you go in, it cannot tell you. If you have a normal body temperature, it does not mean you do not have coronavirus. It means you do not have a fever. So if you go somewhere, they scanned me before I went in, and 2 days later I have coronavirus, they scanned me. Well, it's a thermal scanner and it detects body heat. It does not detect viruses. Are hand dryers effective in killing the novel coronavirus? No, hand dryers are not effective. So when you go into public places and you wash your hands and they have those hand dryers with the heat, it's not going to kill the virus. So you still have to wash your hands, soap and water, 20 seconds, sing the happy birthday song twice, and keep it moving. Or get your hand sanitizer if soap and water is not available, but we prefer soap and water. 20 seconds, clean your hands, and keep it moving. Ultraviolet lamps also should not be used to disinfect your hands or other parts of your body. Okay? Now, I talked about prolonged mask wearing. There was also a question of if prolonged mask wearing could cause carbon dioxide intoxication or oxygen deficiency. And that would be a no. Prolonged use of medical masks can be uncomfortable. However, it does not lead you to carbon dioxide intoxication or oxygen deficiency. So wear your mask. Can people wear masks while they're exercising? Okay, so people should not wear a mask when they are exercising, as masks may reduce the ability to breathe comfortably. So you want to be able to breathe. So no, please do not wear a mask when you're exercising. And also the mask can get wet and sweaty. And when it becomes wet and sweaty, it makes it more difficult to breathe, and it provides a good spot for microorganisms to replicate because they like damp, dark, sweaty places. All right. Oh, here's another myth. Being able to hold your breath for 10 seconds or more or cough without feeling discomfort does not mean that you are free from the COVID disease. So some people used to say, well, if I can hold my breath for 10 seconds, that means that my lungs are good and I don't have COVID pneumonia, so I'm good even if I have all of the symptoms. And if I can cough and it doesn't hurt, then I must not have coronavirus. That's another myth. A fact, taking a bath does not prevent the coronavirus. It just means that your skin is clean, but it doesn't prevent the virus. So, just take a bath. But can regularly using these nose rinses with saline help prevent the infection? So people have wanted to know that too. These saline rinses, or if you squeeze saline in your nose, there's no evidence that regularly rinsing the nose with saline has protected people from infection with the novel coronavirus. It cleans your nasal passages, but no, it's not going to prevent it. And then we talked about vitamin D and these supplements. The micronutrients such as vitamin D and vitamin C and zinc are critical for a well-functioning immune system and play a vital role in promoting health and nutritional wellness. There is currently no guidance on the use of micronutrients or supplements to treat COVID. The WHO is coordinating efforts to develop and evaluate medicines that do. Micronutrients do not. Can eating garlic help prevent infection with the novel coronavirus? Garlic is healthy and it may have some antimicrobial properties. However, there is no evidence that says it prevents the coronavirus. Adding pepper to your soup or to other meals does not prevent or cure coronavirus. It'll make your food hot, it'll make it tasty, but it cannot prevent coronavirus. Drinking alcohol does not protect you against coronavirus, and it can be dangerous. I'm just gonna leave that there. Okay, I gotta put it out there. Spraying or introducing bleach or other disinfectant into your body will not protect you against COVID-19 and can be dangerous. Drinking methanol or bleach does not prevent or cure COVID-19 and can be extremely dangerous. Studies show that hydroxychloroquine does not have clinical benefits in treating COVID-19. Antibiotics are not beneficial in preventing COVID-19 because we said it's a virus and not a bacteria. Now, steroids. If you've heard about steroids, steroids are something that can be used to treat the inflammation of COVID in patients who are hospitalized with pneumonia. Severe pneumonia is what that helps. And do other pneumonia vaccines. So there are people who are over the age of 65 who get a pneumococcal vaccine. That pneumococcal vaccine does not prevent COVID. So that's it, everyone. There you have it. That is my talk on all things coronavirus.
Yeah. Person want to know shellfish.
I talked about shellfish. If you have a shellfish allergy, you can still receive the vaccine. Give some people more questions. Okay, so I hope this session has been informative for you. Please share it. And I know there may have been some people who just wanted to hear what I had to say first before they shared it, which is perfectly fine. You want to make sure that I'm giving good, sound, scientific information, which I am. I hope I have dispelled a lot of myths. I hope I have presented a lot of fact. I hope I have helped you to learn a little bit and understand more about your own immune system, how your immune system works. I hope I have answered a lot of questions and alleviated some fears about this vaccine, why I feel the vaccine is important, but I still want you to be informed. And I hope this has helped you to even want to maybe dig deeper. The information that I presented came from the Centers for Disease website. It came from my knowledge just as being a physician and being, first of all, a scientist. So feel free to fact check anything that I have said with me. Feel free even to make additional comments on this thread that I will go back if there was something, a question that you did have that I wasn't able to answer. If there was something that came up in the midst of my speaking that you had not thought about that you would like to have some additional information on, please let me know. But I really wanted to help. There was a young lady or an older lady who posted on my timeline who, if for anybody, I really hope in all sincerity that I have said something that will alleviate your anxiety, because I sensed a lot of anxiety in your comment, that I have alleviated some anxiety for you, and that you have been given some information, and maybe even some information that you can go back to your own primary care physician with and ask them if this vaccine is right for you. So I do thank you all for your attention, and I did want to say that I actually had this virus has hit home for me very early on during the pandemic. I had a cousin who was hospitalized in Detroit. He was in the ICU and he was on a ventilator, and he did come home. He made it home. He's in his 50s. I also did have the matriarch of my paternal side, my aunt who was in her 80s in Georgia, contracted this coronavirus very early on during the pandemic. And she was actually taken to the hospital by her children, and they sent her home. And she wasn't ill enough to be admitted to the hospital. She doesn't have any pre-existing conditions except for being 80 plus years old. And she was sent home and did well. My mother-in-law is in a long-term care facility, and she was infected 3 times, Calvin? Twice. So my mother-in-law was infected twice in a long-term healthcare facility, and praise God for her, she was asymptomatic both times. So this virus is not the same for everybody. There are some things that we're finding out. There are some long-term the long haul syndrome that people are talking about following infection with this virus, where a lot of people are talking about mental fogginess, some fibromyalgia, just some generalized fatigue. And we won't know. We're just now learning what the long-term effects of infection with this virus are, let alone being concerned with what the long-term effects of the vaccine are. This virus, natural infection, is not without consequence. So
We should not say that our preference is to receive to catch the infection naturally because I want my body's own immune system to fight and to protect me. We don't know how long natural immunity will last, and we don't know what the long-term effects of this virus are. This virus causes inflammation in your body, and we already know the deleterious effects of inflammation in your body. So what is this going to do to your heart, to your liver, to your lungs, to multi-system organs? We just don't know what it is. So I implore everybody to really, really be a student of this vaccine, be a student of your own health, be a responsible citizen of this country, and mask up, remain physically distant when you're in public, and wash your hands, wash your hands, wash your hands. But I would like to dedicate this Facebook Live to my aunt, Dr. Doris Christine Carpenter, who contracted this virus on December 2nd, 2020, and she departed this life on January 2nd, 2021. She is not here to hear this information. She is not here to decide whether or not she wants to take this vaccine. She is not here to say, I would rather contract this disease than to deal with the unknown long-term effects of the vaccine. What I can say is that I've spoken to her children, and we are a family of great faith. And though my aunt contracted this devastating virus did not take her. We cannot say, oh, but if she had not gotten this virus. We are a family of faith, and we believe that death is not the opposite of life. That death is a part of life itself. Each one of us who has been granted the great, great privilege of living and experiencing life has an appointment with death. We each have a purpose that we were specifically created to fulfill. And when our time is done, when we have fulfilled our purpose, we will die. And so, my family has come to the conclusion that COVID did not take my aunt from this earth. It was simply the means by which she was to return to her Heavenly Father. So we will all leave this earth by some manner, whether we sleep and never wake up, whether we're in a car accident, whether we get cancer, whether we have an allergic reaction to shellfish that we didn't know we were allergic to, whether we drown. We don't know how we are going to leave this earth, but we do know when our expressed purpose has been fulfilled, our time will come and we will leave this earth. So to my aunt, Dr. Doris Christine Carpenter, COVID entered your body. It took over your body, but not without permission. We know that your Lord and Savior permitted this virus to enter your body because he knew it was the means by which you were to transcend from this earthly life until life everlasting.
And so I dedicate this Facebook Live to you. You are not here to hear what I had to say, but I hope that what I had to say will help some other person to choose to wear a mask, to socially distance yourself, to wash your hands, and to receive the vaccine. And I want to end on, well, I want to say that many of you may have seen the video that I posted yesterday where there was a vaccine clinic at my place of employment where Advocare, Kressville Pediatrics served as a vaccine administration site for all the employees of Advocare, and for the month of January, employees of Advocare could come into our office and receive a vaccine. When those thousands of people had the opportunity to receive the vaccine at our site or not, when there were doses left over, the owner of my practice opened it up to the family members, the parents and grandparents of the employees of our specific Advocare, Kressville Pediatrics. And because of his generosity, my 96-year-old grandparents, my 70-some-year-old mother, brother, my aunt, my husband received the vaccine. I was able to go into the office yesterday and administer the vaccine to 20 people, 3 of whom were my relatives, 17 of whom were grandparents, husbands, aunties, uncles, of people that I work with. And it was my great honor. And so being a physician is my purpose on this earth. It is what I was created to do. And as I was created to do that, I serve every day as a humble servant in the mission field that I was assigned to. And I use my voice of influence with great responsibility and with great awe to bring good, sound, scientific, evidence-based healthcare to my patients in this community every day that I rise and that I go to work. And I hope that I have done this for you today. But the last thing that I would like to leave you with is the first stanza of a poem by Ellen Bass. And it's called The Thing Is. And the first stanza of the poem says, "The thing is to love life, to love it even when you have no stomach for it. And everything you held dear crumbles like burnt paper in your hands." And I would like to say that right now, each of us is enduring life, even though we can't stomach this virus, even though everything that we held dear is crumbling like paper in our hands. But we don't have to allow it to be so. We have the power and the responsibility to be effective citizens and flatten the curve and take this coronavirus, this Sars Cov-2 virus that is causing this COVID-19 pandemic, flatten it and provide no human host in which this virus can multiply and infect. So I thank you for the time, and I thank you for the great opportunity to be a humble, willing servant. Thank you. Thank you, everybody. Thank you.